Word on the street is that there's a new kid on the block dispensing health advice. You guessed it, we're going to do ChatGPT today. Let's ask it some questions. Some of these are questions that you all sent in to me, and some of them are questions that I thought would be fun to ask this ChatGPT thing. So let's get into it. Give myself a little head bubble. All right, ChatGPT, can the carnivore diet cure SIBO? There is no scientific evidence that suggests that the carnivore diet can cure small intestinal bacterial overgrowth. SIBO is a condition of yada, yada, yada. While some proponents of the carnivore diet claim that it can improve symptoms of digestive disorders, including SIBO, there's limited research to support these claims. Additionally, a diet that consists only of animal products can lead to nutritional deficiencies and other health problems, so it's important to speak with a healthcare professional before making any significant changes to your diet. If you're concerned about SIBO or any other digestive condition, it's important to seek advice of a healthcare professional for an accurate diagnosis and appropriate treatment. I think that's pretty spot on. There really is no good quality evidence at this point. I shared one article with a very small cohort of patients. I believe it was 6 people, and it was published in 2021. This was not indexed on PubMed. It was not a very high quality study, and it was not of the caliber that you would typically see on PubMed. But there was one study that took a stab at it, and while it did show some benefit, there were also a lot of issues with the study. Namely, one of the ones that I took issue with was they were measuring with a lactulose breath test, which is notoriously inaccurate when they were diagnosing people with SIBO. But aside from that one and only paper, I could not find a single thing indicating that the carnivore diet cures SIBO, as some bigwigs on YouTube have recently claimed. Now, the question of can it help mitigate or control symptoms, I think is a yes. But again, like at what cost, right? I think there's a big difference between cure and remission, or cure versus band-aiding of symptoms. So that's where I would maybe add a little bit to ChatGPT's opinion. But overall, that's pretty decent. I would give it a solid 9 out of 10. Let's see if it can tell us what causes IBS. The exact cause of IBS is not well understood, but it is thought to be a combination of factors including, all right, I like it already, several things. Gastrointestinal motility, okay. Nervous system, yes. Increased sensitivity to pain, yeah, it's talking about visceral hypersensitivity here. The microbiome, so basically dysbiosis, right? Too many bad guys, not enough good guys. Food intolerances, yeah. Wheat, dairy, fructose, yeah. Inflammation, I agree with that. That is correct. You could also maybe kind of put a sub-bullet under the inflammation thing and say mast cell and histamine style inflammation. It's important to note that these factors can interact with each other and affect IBS in different ways. The exact cause of IBS can vary from person to person, and more research is needed to fully understand the underlying mechanisms of this condition. Yeah, I think that's actually pretty spot on. You could add, again, maybe a sub-bullet point under the microbiome part about, Candida versus SIBO versus LIBO versus EMO versus whatever flavor of the month you're looking at. Again, under inflammation, you could talk a little bit about mast cell histamine kind of stuff. There's quite a lot of research with that. The only thing I think I would really add to this for a 6th bullet point is that there is some involvement of hormones, particularly estrogen, and the gut mucosa and motility and symptoms that we would associate with IBS. So there's probably one additional bullet point I would put there, but I would say ChatGPT got 5 out of the 6 that I would put on there. So that's pretty rock solid. Let's see if it can tell us what the best test is for SIBO. All right, there's several different ways to diagnose SIBO. All right, lactulose breath test. You drink a solution of lactulose, which is a type of sugar. If there's an overgrowth of bacteria, the bacteria will ferment the sugar, producing hydrogen or methane. That's exhaled, yep. Other tests that may use to be diagnosed SIBO include glucose breath test, which is similar to lactulose but uses glucose instead, correct? Small bowel imaging test. No. Endoscopy and biopsy, yes. This is the first one that I feel like it's actually getting something incorrect. Lactulose breath test, glucose breath test. I mean, heck, you could even do a fructose breath test potentially. Like any sort of breath test, yes, that's what's most commonly used to diagnose SIBO, certainly. Endoscopy with an aspirate is what is called the gold standard. It's not the greatest. It still has a lot of flaws, but that is considered to be the gold standard for diagnosing SIBO. The one that I'm taking really big issue with is number 2. You cannot diagnose SIBO with an X-ray or an MRI. You would have to have a giant oozing pustule, and you would be like in the emergency department with something that overt. Like, to say that you could diagnose this with an X-ray or an MRI is really quite incorrect and misleading. So I'm just going to give you an F. I'm using all sorts of different grading criteria all of a sudden. So we've got a 9 out of 10, we've got a 5 out of a 6, and now just F. Can I give it an F- on this one? I don't even know. All right, moving on. Let's see if it can give us the best test for dysbiosis. So related, but a little different. Dysbiosis refers to an imbalance in the gut microbiome, and there are several tests that can be used to assess this condition. However, it's important to note that there is no single test that can definitively diagnose dysbiosis. The best approach often involves a combination of tests, right? Okay, so the tests include stool test. A stool sample can be analyzed for the presence of beneficial bacteria, harmful bacteria, yeast, and parasites. All right, yeah. Blood tests can be used to measure levels of inflammation, which may be elevated in individuals with dysbiosis and nutrient deficiencies. A urine test can be used to measure the metabolic byproducts that are produced by gut bacteria, providing insight into the composition and activity of the gut microbiome. And breath tests can be used to measure levels of hydrogen and methane in the breath, which can provide information about the presence of SIBO. Yeah, this one I think is iffy too. Stool test, sure. My problem with number 2, the blood test, is that it's so non-specific, right? Like, you could have elevated markers of inflammation on a blood test because you have a kidney infection, because you have SIBO, because you have a chronic injury that won't heal. You could potentially have something like that from any number of infections or dysbioses or injuries or autoimmune processes or cancer. That is so unspecific. I don't really think it's a good indicator for gut dysbiosis. The urine test, I'm really surprised that they put that on here, because as I dig deeper into the topic of whether or not organic acids testing is validated and accurate, and like, is there actual research to back up claims made by companies like Great Plains? I'm finding that there is a distinct lack of research supporting the use of metabolic urine testing. So I'm very surprised that ChatGPT put that in there as well. Really, I think that your best bet is some sort of stool test, maybe followed by breath test, but that's even pretty dicey. This is another F- for me. This one's not looking so good. All right. I had such high hopes. This was supposed to like beat the Harvard Medical School entrance exams. Come on. Let's find out if an eating disorder can cause gut problems. I know the answer. Do you? Yes, eating disorders can cause gut problems. Eating disorders can have a significant impact on the digestive system and gut microbiome, leading to a variety of symptoms such as malnutrition. Eating disorders often involve restricted eating patterns and can result in malnutrition, which can affect the gut microbiome by altering the balance of bacteria and reducing the diversity of species. Gastrointestinal symptoms, including abdominal pain, bloating, constipation, and diarrhea, correct? Leaky gut syndrome, maybe. Microbial imbalances, yeah, like dysbiosis kind of stuff. It's important for individuals with eating disorders to seek treatment as soon as possible, as these conditions can have serious and long-lasting consequences for both physical and mental health. Correct. Treatment of eating disorders typically involves a combination of nutritional therapy, counseling, and medication. In some cases, probiotics, prebiotics, and other dietary intervention may also be recommended. Yeah, I think the things that I would say is it's going to depend a little bit on the type of eating disorder, obviously. So like acid reflux and esophageal damage is going to be much more prevalent in something like bulimia, where there's vomiting. Leaky gut, interestingly, this is just a fun fact. I don't know about bulimia or binge eating disorder, but there's actually some evidence that people with anorexia who have loads of GI symptoms due to the anorexia and the malnutrition, interestingly, leaky gut syndrome seems to be less prevalent in that population for some reason, just based off the research I've recently read. So, I would say 3 out of 4 are pretty decent on this one. So what would that be, like a C? I'm going to give it about a C. Let's do one more here, and then we're going to ask it some of your questions. Best test for Candida. Candida is a type of yeast that's commonly found in the human body and usually kept in balance by the beneficial bacteria of the gut. That's correct. However, when the balance of bacteria in the gut is disrupted, Candida can overgrow and cause infection and other symptoms. Correct. So like antibiotics, steroids, immunosuppressant drugs. Let's see. There are several tests that can be used to diagnose Candida overgrowth. Stool test. Yep. Blood tests. Yeah, for Candida antibodies. Don't know how useful it is. A urine test. Here we go with the urine test again. I don't know why ChatGPT is all about the oat. Culture. Yeah, a sample of discharge or tissue that's taken. Yeah, you could do a culture potentially. And a saliva test. Yeah, I think that would probably be kind of in line with the culture, right? Like looking at a sample of the excretions or the tissues. Important to talk to your healthcare provider, yada, yada, yada. Yeah, I think this one's pretty solid. Again, the only one that I'm really raising an eyebrow at is number 3, the urine test. I don't know. I'm really surprised that ChatGPT seems to be a really big fan of the oat test. When it doesn't seem like it's super clinically, it's not super like well validated in research, but I think 4 out of 5. We're getting a little bit better. We're getting into like the B- range. So this came from one of my viewers out there. How to get relief from prolapsed hemorrhoids. Prolapsed hemorrhoids can be uncomfortable and cause a range of symptoms, including itching, pain, and bleeding. Several ways to get relief. Keep the area clean. Yeah. Easier said than done, considering the location, perhaps. Apply a cold compress. Yeah. Use over-the-counter creams and ointments. Take warm baths. That seems a little bit counter to number 2 with the cold compresses. Avoid straining during bowel movements. Correct. Good hygiene. That's very in line with number 1. I feel like this is just repetitive now. Yeah, I mean, I think that overall this is decent. Again, it seemed like they were really grasping for additional bullet points at some point. Like the bit about good hygiene is basically duplicate information from number 1. And the warm baths, I'm not really sure about that. It kind of goes against the idea of the cold compress. Maybe they're talking about sitz baths or herbal baths. I would say one additional tidbit is that there are herbalists who make creams and salves with herbs in them that are for hemorrhoids. And I've had some patients get such things off of Etsy. You could just type in hemorrhoids on Etsy and it'll pop up with a whole range of like creams and topicals and salves and that sort of thing. And some of those I have found could be quite helpful. Let's see. Somebody asked, is it possible to recover from SIBO if you're over 65? Yes, it is possible to recover from SIBO regardless of your age, including if you're over 65. The recovery process from SIBO involves addressing the underlying causes of the condition, and restoring balance of the bacteria in the gut. That's pretty good. This can typically be done through a combination of dietary changes, lifestyle modifications, and in some cases, the use of antibiotics. Yeah. However, it's important to keep in mind that as we age, the digestive system can become less efficient, making it more difficult to treat some conditions, including SIBO. Additionally, older individuals may be more prone to certain conditions that can increase the risk of SIBO, such as reduced mobility, changes in gut motility, and the use of certain medications. I would also add in low stomach acid, much more prevalent as you get older. Yeah, I think that is actually a pretty good answer. I'm going to give ChatGPT an A-, and I'm only saying A- because they didn't mention the stomach acid thing, which has been documented to be more of a thing as you get older. Overall, A-. I'm pretty happy with that one. All right, let's see. Rashad asks for best tips to minimize gas and bloating. Let's see what you got, ChatGPT. Gas and bloating could be caused by a variety of factors, including certain foods, digestive conditions, and eating habits, correct? Here are some tips to help minimize gas and bloating. Avoid foods that cause gas. Yeah. Carbonated drinks, broccoli, etc. Eat slowly. Eating too quickly can cause you to swallow air, which can contribute to gas and bloating. Eating slowly and chewing your food thoroughly can help reduce the amount of air you swallow. Yeah. I have something to add in a minute. Stay hydrated, yes. Regular exercise, yep. Consider probiotics, certainly. Avoid chewing gum and drinking through a straw. Again, they're going back to the swallowing of air thing. And reduce stress. Stress can slow down digestion and contribute to gas and bloating. Finding ways to manage stress through meditation, yoga, and deep breathing can help minimize these symptoms. Yeah, that's pretty decent too. The only thing I would add is when they were talking, I don't know, when ChatGPT was talking about eating more slowly and chewing your food thoroughly, it only mentioned the swallowing of air part of the hypothesis. The other thing is that you're going to get better vagal tone, better gut-brain axis connection, and that's going to facilitate digestion. It's going to facilitate the release of digestive juices. Also, you're going to take a lot of pressure off the stomach because now the stomach can do its job and it can deal with like mushy stuff instead of giant chunks of stuff. If you're not chewing, if you're not using your teeth and your tongue to their maximum potential, then you're basically like shunting that burden of that part of the process, the mechanical breaking down of the food. You're putting that burden on the stomach, and the stomach doesn't have teeth. So it cannot and it will not mechanically break down your food in the same way that teeth and a tongue would. So that's another two kind of ways to look at it is that, yes, I think the swallowing air thing is important. Two, just like physically breaking down your food into smaller bits that are easier to digest. And three, taking your meals slowly and really digesting them as you eat them. That's going to facilitate digestion and gut-brain axis function. So overall, I think this was a pretty decent answer. Again, I'm going to give it like an A- or a B+, just because it didn't talk about, it kind of hyper-focused on the idea of swallowing air. And I think there's a lot more to it than that. But overall, it was pretty decent for an answer. Rachel asked, how can we increase beneficial flora without probiotics? There are several ways to increase levels of beneficial bacteria in your gut without taking probiotics, including eat prebiotic-rich foods, correct? Look at that. Onions, garlic, leeks, asparagus, bananas, whole grains. So basically a lot of FODMAPs and a lot of the stuff people avoid. Not coincidental. So prebiotic-rich foods, fermented foods, yes. Fiber-rich foods. I mean, that kind of goes with number one to some degree, but yes. Reduce sugar and processed foods. Yeah. I don't know if sugar and processed foods specifically are as bad as we think they are for the gut. I think it's just that if you're eating a lot of processed junk, you're crowding out, you're taking up space in your diet that would otherwise be occupied by whole foods and fiber-rich foods. So I guess that is okay to be in there too. Reduce stress. Yes, stress can reduce the level of beneficial bacteria in your gut and promote the growth of harmful bacteria. Yeah. The only two things that I would add here are exercise. Exercise has been shown to increase the diversity of the gut microbiota. So exercise is another great way. And adequate sleep Also, there's something called the microbial clock, and basically our gut bacteria and our gut microbiome gets the information about time of day and like what to expect. They get that information from us and our circadian rhythm. So if your sleep is shit, that also means that their sleep is shit. So sleep and exercise I would add to this, but otherwise this is a pretty good list. B+. All right. Last one from you guys, and then I have one that I want to ask selfishly for myself. Terrence asks, how to heal the gut-brain axis. The gut-brain axis is the communication highway between the gut and the brain. A healthy gut-brain axis is essential for overall health and well-being, and it can impact a wide range of functions, including digestion, mood, and immunity. Correct. Here are some ways to help the gut-brain axis. Eat a balanced diet. Eating a diet that is rich in whole, nutrient-dense foods can help support the health of the gut and the gut-brain axis. Focus on eating a variety of fruits, vegetables, whole grains, and lean protein. I dig it. Reduce stress. Chronic stress can disrupt the balance of bacteria in the gut and negatively impact the gut-brain axis. Yep. Get enough sleep. Yep. Just talked about the microbial clock. Limit sugar and processed foods. Exercise regularly. Consider probiotics, and speak with your healthcare provider if you're experiencing persistent symptoms that you believe are related to the gut-brain axis. Yeah. It's important to remember that healing the gut-brain axis is a process and may take time, but making small changes to your diet and lifestyle can have a positive impact. This is pretty decent. I agree with basically everything on here. I would just add a couple of things. It's the gut-brain axis, right? So most of what this spit out to us is more gut-focused, right? So like probiotics, limit sugar, fiber, and those are all really good things. But also think about it from the angle of things that would benefit the other end of this highway. So think about things that would be good for the brain and for your mental health. Because remember, what we're really talking about is the balance between rest and digest and fight or flight. So, getting treatment or help or counseling for anxiety or depression or mental health issues or trauma, really like quote unquote doing the work of the mental health work is really, really, really critically important for gut-brain axis function. So that's the only one I think I would add to this list, but otherwise it was pretty good. So I'm going to give it an A- again. I think that was another A- worthy one. And now I have one final question. As a lot of you know, I had ear surgery recently, and unbeknownst to me, they shaved a whole bunch of my hair when they did that. So ChatGPT, I would like to know, how do I grow my hair ASAP? I'm going to give my ear doctor a piece of my mind, because they did not do that when I had this procedure as a youth. All right. Growing hair takes time and patience. No, that's not what I want to hear. But there are some things you could do to help promote healthy hair growth. Eat a balanced diet. Check. Reduce heat styling. Check. I only ever use my blow dryer on lukewarm heat, and I haven't straightened my hair since 2006. Protect your hair from damage. Exposure to sun, wind, and chlorine could damage the hair and slow down growth. Consider wearing a hat or a scarf to protect your hair from the elements, and use leave-in conditioner to help moisturize and protect the hair. All right. Avoid tight hairstyles. Yes, that I've been actively doing that for a little while now. I learned that was a no-no. Get regular trims. Well, I got a heck of a trim. So that's not a problem. Massage your scalp. Yeah, I actually just learned this one too. Massaging your scalp can increase blood flow to the hair follicles will help promote healthy hair growth. That is correct. Use hair healthy products using shampoo and conditioners that are formulated for healthy hair. I mean, that's kind of a silly one because shouldn't all shampoo and conditioner be marketed or formulated for healthy hair? I know that they're not, but that just seems so silly. It's important to remember that everyone's hair grows at different rates, and some people may find that their hair grows more quickly or slowly than others. Additionally, genetics, hormonal changes, and other factors can impact hair growth. If you're concerned about your hair growth, yada, 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 talk to your doctor. Okay, yeah, so let me pull you back off of that. Yeah, so this is what I was talking about because you couldn't see in the hair bubble. So again, going to give my ENT a piece of my mind when I see him in 2 days for my post-op appointment. Yeah, I think that last response was decent. One that it left out that I've been researching a little bit more is the use of hair oil or like scalp oils. There's a whole wide world of like learning about hair oils, scalp oils, and using those to keep your hair healthy. And another one that I've seen a lot and I've started implementing is sleeping with a silk bonnet or a satin bonnet and pillowcase so that you don't get as much like friction damaging the hair follicles. So overall, I think that was a fairly good answer. I would give it like a B. I don't think it went above and beyond. It didn't mention a couple of things that I've read more about. And it didn't emphasize the role of iron in particular as much as I maybe would like. But overall, I would give that last response another like B minus. But I'm overall fairly impressed with ChatGPT. I do think there were a couple of dud answers. But overall, it did a pretty decent job. It got passing remarks for almost all of the questions that I asked it today. There were a couple, like again, the Candida and the oat kind of thing and some of the SIBO stuff. Maybe not, but otherwise it was pretty much hitting the mark on a lot of the other stuff that I was asking it. So I'm reasonably impressed. Would I use this for medical advice? Probably not. Certainly not exclusively. You could play with it and take a stab at it, and it might give you some ideas of things that you could do more research on, right? So it spit out like 6 different things that are involved in the pathogenesis of IBS. Maybe that could give you some new ideas, and then you do a little bit more research on those 6 topics to see which one is most relevant to you. I certainly wouldn't take like specific advice and action just from ChatGPT, but I don't know, like a overall grade, I would say I'm going to give it B minus overall as far as the information that we received today, which is actually better than I anticipated it would give us. So overall, pretty decent. Let me know, have you played with ChatGPT? Is there anything else I should ask it? Should I do a part 2? If you guys could come up with preferably the most like ultra specific or the most crazy gut health questions, if I get enough of those in the comments, I will do a part 2 and I will weigh in on those as well. Let me know, and I will see you in the next video. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.